Muffin top. Sweet with blueberries. Not with your blue jeans. It's time to invest in yourself. Schedule a consultation today. Saddlebags. Handy on hogs, not on your hips. It's time to invest in yourself. Schedule a consultation today. Bad hand. Tough break in life, but we can re-deal. It's time to invest in yourself. If you have hand or arm malformations or injuries, we have solutions. Schedule a consultation today. Perfect Pear. What's right for her? What's right for you? It's time to invest in yourself. Schedule a consultation today.
Breast augmentation is an extremely fulfilling operation. The bulk of the patients who seek this operation seek it for the right reasons, and that is self-esteem. I want to look better in my clothes. I want to be more proportionate. I used to look better. I've lost volume, and I'm through having kids, and I want to get back to where I was. Those are the right reasons to have it. On average, I would say it would take plastic surgeon between 45 minutes and maybe an hour and 15 minutes to perform the procedure. A long weekend's usually sufficient recovery after breast augmentation. The patient's usually drowsy the afternoon of surgery. The next morning, it's anticipated that you could shower, that you would probably be able to drive a car. Exercise, strenuous exercise in particular, may be delayed for 2 to 4 weeks depending on the individual physician's recommendation. The decision is whether to go with a saline implant or a gel implant. Each has its advantage, each has its disadvantage. In my particular practice, at this particular juncture, about 60 to 65% of the patients choose gel implants. Any physician who is licensed is obviously capable of alleging they can perform an operative procedure. However, the physicians in this particular group are all board certified by the American Board of Plastic Surgery, and that basically is the gold standard.
Eyelid surgery is a generic term for numerous operations and techniques to help with periorbital rejuvenation. Basically, you're removing excess skin and fat from around the eyes and reshaping some of the tissues to give the patient a more wide awake or more alert appearance. A good candidate for eyelid surgery is anyone who feels heaviness on their upper eyelids as well as bagginess on their lower eyelids. Anybody who has a decrease in vision when they look upward and the upward gaze is a good candidate, and may be a candidate to have their insurance pay for the operation. The lower eyelid surgery is more designed for those who have bags or dark circles underneath their eyes. There are benefits of being more alert, of being more awake. It's hard to put your finger on exactly what the patient has had done if you're not aware that the patient or your friend has had eyelid surgery. It can often be mistaken as getting a new shade of makeup or having a good night's sleep or being on vacation, but it's the actual operation gives you a more wide awake, more wide-eyed appearance. For the rest of your life, you can have the benefits of the eyelid surgery. Once that fat and excess skin is removed, the patients usually have lifelong benefits from it. There's always some continued aging in the area, but the fat and skin usually does not grow back in the area like it would in other places in the body. Board certification is very important. Operating on someone's face is operating on their most prized possession. Measurements in the face are done in millimeters, and the nuances involved with the different operations, especially eyelid surgery, are very specific.
There are a lot of patients, particularly ladies, but sometimes gentlemen as well, who have problems with back, neck, and shoulder pain when the breast gets overly large or sags a lot. They may also have a lot of cysts and other problems. And to try to get rid of some of those symptoms, breast reduction surgery is often a very, very good choice. It's used for patients that have back, neck, and shoulder pain when the breast gets overly large or overly sags, and sometimes men have some problems as well with unsightliness or difficulty in wearing their clothing, and these patients are helped by breast reduction. The surgery itself usually takes about an hour and a half to 2 hours. It's done at the Face and Body Center in the main operating room under general anesthesia. That means you're sleeping during the operation. We also go over, before the surgery itself, what to expect not only during the operation but afterwards, so that you're well versed in what to expect and how to help yourself and take care of yourself after the operation. Each and every policy is a little bit different. We do have folks here who will look into your policy and help us make that determination. First of all, it means that you're getting a quality surgeon who's well trained and who knows how to take care of you in the best possible way. Here at the Face and Body Center, all of our plastic surgeons, including myself, are fully board certified. You're getting the best, someone who knows their way around the operating room and who knows what to do should you have difficulties or problems.
Tummy tuck is a procedure that is done surgically to remove the excess skin and fat to the lower abdomen or the lower and the upper abdomen. Patients who have had a stable weight for 6 months and patients who do not have medical problems, patients who have had multiple pregnancies and cannot get rid of the excess skin and fat below the navel, and also people who cannot get rid of the stretch marks after pregnancy are good candidates. There are two types of abdominoplasty. One is the full abdominoplasty and the other is the mini abdominoplasty. The mini abdominoplasty is done for patients that have fullness only below the navel and have had multiple pregnancies and they cannot get rid of the little fullness that they have below the navel. The candidate for the full abdominoplasty is where the muscle tightening is done up to the rib cage and they have excess skin both above and below the navel. The first 2 days after surgery, they are kept comfortable with pain medications and muscle relaxant, and within the first 3 weeks they regain all of their strength and are able to do everything they need to or want to after the 3 weeks. Patients are extremely happy with abdominoplasty. This is something they've always wanted to get rid of the excess skin, and they feel better about themselves and also are able to exercise better and also stay motivated with the diet.
Patients that consider a breast lift most commonly are women that have had several children or they've lost a considerable amount of weight, and in doing so they lose breast volume. When considering a breast augmentation versus a breast lift, if you can get away with doing a breast augment, that's always preferable because of the lack of incisions. But many patients are not candidates for a breast augmentation and require a breast lift. Here at the Face and Body Center, we have several surgeons that have done a large number of these procedures, and I think when considering a surgeon to do this, experience is extremely important. When you're looking at the recovery period, it varies from patient to patient, but about a week of no work and then another week or two of reduced activities, and then probably 3 weeks back to before you can consider exercise. Breast lift can have a significant effect on the ability to breastfeed, and if one's considering this operation and planning to have future children, I would probably put it off until I'd finished having my children. When you're looking at the long-term results from a breast lift, one can expect 10 to 15 years of significant improvement. There is no surgical procedure that lasts a lifetime, and at some point one may consider some revision, but overall patient satisfaction with this procedure is high.
Liposuction is a tool that we as plastic surgeons here at the Face and Body Center use to remove unwanted fat deposits in certain parts of the body. It's not a weight loss procedure, it's more of a body contouring procedure. Anybody who doesn't have an excess of skin laxity, who has extra deposits of fat in various areas of the body that they're uncomfortable with and they're not pleased with, is a good candidate for that. We'll do this liposuction either under local anesthesia or under general anesthesia, and routinely you go home the same day. If we do large areas or multiple areas, then we have the ability at the Plastic Surgical Center of Mississippi, which is an accredited surgery center, to keep you overnight to be monitored. After the procedure, for a day or two, you're going to be sore. Most patients state it feels like they went and worked out too hard, did a new muscle group, and they have soreness from that standpoint, but not a lot of significant pain. It's very important to have a physician or cosmetic surgeon certified by the American Board of Plastic Surgery do your procedure. Here at the Face and Body Center, all of our surgeons are board certified. We've all had a minimum of 3 to 5 years of general surgery training and 2 to 3 years of plastic surgery training. Even though you'll realize in the next day that you already have a better size and shape, your final results take about 6 months before you see exactly what your results will be. The vast majority of patients who have liposuction, if they have realistic goals and expectations, are very pleased with the results.
Facial cosmetic surgery can be broken down into 3 general zones of the face, and we like to approach any cosmetic procedure on the face as approaching these particular zones. The forehead and the brow, as well as the eyes, are one zone in the upper face. Then the mid face, you have the cheek. In the lower face, you have the mouth, the jawline, and the neck. Our goal with facial cosmetic surgery is to maintain balance between the 3 different zones. We see a wide variety of age groups. Traditionally, 50-plus year age group was when we first started considering full facelift procedures. Nowadays, we're seeing younger and younger patients that are considering facial cosmetic surgery, early 40s even. Of course, we take our time, we're very meticulous, and I'm generally focusing on one patient that day. It's usually done as an outpatient or as an overnight stay in our facility here. And recovery time varies from 1 week to up to 2 or possibly even 3 weeks for more extensive procedures. Facelift and facial cosmetic surgery in general is a very rewarding procedure. The type of facelift that I do is really designed to be more subtle, very natural looking, and the incisions are all well hidden, and we're not in any way changing your underlying appearance. It's just a more youthful, more rested, a better you.
Nerve compressions such as carpal tunnel syndrome, arthritis of various types which produces pain, and the contractures such as Dupuytren's contracture. That's a problem that's caused by pressure on a nerve, usually at the wrist level. When we see a patient for the first time, we may treat them with a splint, with anti-inflammatory medications, and sometimes with a cortisone injection or something of that sort. Surgical treatment of it requires a decompression of the nerve, and that is to cut some of the surrounding tissue to give the nerve a little more room to breathe, so to speak. There we do such things as replace joints in some instances, or remove the bone that's causing the pain and try to restore function at the same time. Trigger finger, of course, is the nickname, and it is due to the fact that sometimes the finger locks in a flexed position. The treatment of that can sometimes be quite simple with a cortisone injection, but if that fails, then surgery is performed to relieve the tightness around the tendon that is failing to function. Surgery of any type carries a risk, and the risk can be minimized in a number of ways, but perhaps one of the most important ways is to have the surgery performed by someone who understands the problem, recognizes what needs to be done for the treatment, and has the experience to carry it out successfully.
The surgeons here at the Face and Body Center use various injectable products to treat wrinkles on the face non-surgically. More of our patients are women that are having non-surgical treatments of their face, but we do a fair amount of men as well. The most common injectable that we use is called Botox. Most people have heard of Botox, but there's also a similar drug out called Dysport. We use these to temporarily keep muscles that are attached to skin from moving. And therefore, if the muscle doesn't move, the little animation lines that you get across the forehead, between the eyebrows, at the lateral eyes, don't tend to show. I've had patients young as 20 that we've used it, but 30 to 35 years old is most common. When you're 30 is when gravity starts taking over and you start noticing some of these wrinkles and your brow starts falling a little bit. And that's about the time we start using the injectables. When you use the injectables such as Botox and Dysport, they are temporary, and they take about 2 to 7 days to start working. And then they work pretty well for anywhere from 3 to 6 months. 3 to 4 months is more realistic. And even though they take 2 to 7 days to start working, they wear off much slower, 3 or 4 weeks before all their effects are gone. Some of these products are touted to be used at Botox parties and at salons, but there are real drugs and there are real potential complications. And if you don't have knowledgeable physicians there, or you don't have any equipment backup, that's just not safe to do.